The American Society on Aging was founded in 1954. 66 years later, people are living prosperous and longer lives. However, many are living with social and economic inequities and inequalities. And the pandemic, it has reminded us that this country doesn't embrace aging. What will happen in 10 years when 1 in 5 Americans will be over 65? The American Society on Aging is transforming itself to tackle the challenges and invest in the opportunities that this demographic change will bring. The new ASA reflects our year-long programming and meaningful membership experience. The new ASA reflects our commitment to unite, to empower, and to champion all of you. But most importantly, the new ASA reflects our optimism for the future of aging. On behalf of everyone at the American Society on Aging, I am proud to introduce you to the new ASA.
Learn more and join us at www.asaging.org.
Welcome, everyone. I'm Ken Dykewall. I'm the host moderator of these legacy interviews, and we're here today for number 3, and we've got a very special hour about to happen. Let me first introduce my guest. Dr. Linda Fried, MD, MPH, is an internationally renowned scientist, educator, clinician, and global leader in the fields of epidemiology, public health, and geriatrics. Dr. Fried has done seminal work in defining frailty as a medical syndrome, in characterizing disability, studying cardiovascular disease and multimorbidities in older adults, and illuminating their causes and the potential for prevention as keys to optimizing health for all people as they age. Early in her career, Dr. Fried co-founded the Experience Corps, I think right around a quarter of a century ago. She also founded and led the Johns Hopkins Center on Aging and Health. She directed the Johns Hopkins Division of Geriatric Medicine and Gerontology and held joint appointments in the schools of medicine, public health, and nursing. In 2008, she moved on to become the Dean and Delmar Professor, of Public Health, and I should say the first female dean at Columbia University's renowned Mailman School of Public Health. She's also co-chair of the National Academy of Medicine's Global Commission for Healthy Longevity, and she has served as the president of the Association of American Physicians. And I was noting in doing my homework for this session, in her spare time, she's also authored over 500 peer-reviewed articles and book chapters. Welcome, Linda Fried.
Thanks, Ken. And I'm really honored and thrilled to be here with you.
Well, we've got a lot to dive into. I've got pages of questions, and so I'm going to make you uncomfortable in a few moments here. But before I do, your staff sent us over a few pictures, and so I'm going to see if I can get them up, and maybe you can tell us what we're looking at. Okay, no, start. All right, so there you are somewhere with 3 handsome men. Who are these people? And where were you?
So I put this, they sent you this picture because you wanted a picture of me as a young professional, and it was the only one I could find, to tell you the truth. But this was an event actually at Disney World for the held by the American Geriatric Society, I guess in my honor because I received the New Investigator Award at that time.
Wait, we're looking at a picture of you, and I think it's your husband and your sons.
Oh, I can't see the photos.
Oh, I'm sorry. Yeah, we probably got them in different order than you. I'll tell you what they are. It's a picture. It looks like you're in a faraway place.
Oh.
And your husband and your sons, I believe. Tell us about them.
So that's one of my favorite photos. So that's my family, my nuclear family. My husband, Joe Margolick, and my 2 sons, John and Alex, and we were in Scotland on a vacation, going hiking and having really a marvelous time.
The next picture, I think the next picture, it looks to me like it might be in France. Were you winning some kind of an award here?
Yeah, so it was very meaningful. It was the French national. In the occasion of the awarding of the French National INSERM Prize international prize in medical research. And I was really honored out of the clear blue sky to be selected for that prize, with a recognition of, I guess, decades of the work that you just described.
Fantastic. And the next picture is there you surrounded by two women on one side and two men on the other side. Do you know which this picture is?
I do. I can't see it, but these are some of my wonderful collaborators. I've been really so lucky to work with a core group of about 20 wonderful scientists and physicians over the years on all of the work really that you cited before.
Okay. And the last picture, I thought this must have come by accident. What are we looking at here? It looks like something resembling martial arts.
Oh, well, I think what you're looking at is something that is martial arts. So and something actually very important to me. So I trained for many years in Aikido, starting in my early 20s. And you're looking at a photo of me teaching a young student Aikido. I think this was before I got my black belt, when I started teaching adults. But Aikido is a martial art that teaches nonviolent self-defense with the ability to actually lead change, really, to redirect aggression in a way that you can protect the aggressor from being hurt, while also redirecting their aggression so nobody else, including yourself, gets hurt. And it's a beautiful art.
So you are black belt. Are you layers of black belt? How does that work?
I'm a beginning black belt. So, because at some point I actually went off to medical school, and then my training kind of tailed off. I still do Aikido in my head, probably daily.
All right, we're gonna come back to that when I ask you how you've managed to accomplish so much in the face of adversity. I'm wondering if some of your Aikido training has come in handy, but let's hold that for a moment. So I've got some questions. Mm-hmm. You began your career as a paralegal, and then you became a social worker, and then you became a physical therapist, and then you decided to go to medical school, and somewhere in the middle of that, you ran some kind of a blues club or blues network or some music thing. And then you decided to pursue geriatric medicine. What motivated you to become a doc and to become a geriatrician? What was going on inside of your head, or what did you see that you could apply yourself towards?
Well, I didn't go to, and when I decided after, as you said, about 5 years of working after college, and when I decided to try and go to med school, I had no intent to be a geriatrician. In fact, it didn't occur to me until someone suggested it many years later, Bill Hazard. But I did actually know that I cared a lot about health, and that had come to me over the course of 5 years of work, and it had come to me in very many different ways. Studying Aikido taught me a lot about health and intrinsic resilience and actually movement. I was not a physical therapist. I volunteered in at a rehab institute because I was interested at one point in physical therapy. And I learned a lot about what affects the circumstances of function and disability working as a caseworker in Chicago for the Department of Public Aid. And realizing that so many people who were disabled as a consequence of the circumstances of their life.
For example?
For example, people who had difficulty walking, but if they had the resources to actually get physical therapy, to have some assistive devices, to be able to actually change the physical environment of their home so they didn't have to climb down 3 flights of steps. They could have been active and engaged in the world, but they didn't have those resources.
So, Linda, I have learned that your mom was a musicologist and feminist scholar. She got her college degree in her 30s. She began graduate school in her 40s, got her PhD in her 50s. In what ways did your mom influence your life and the way you are?
You did your homework. She was, my mother, Adrienne Bach, was born the year after women's suffrage was passed in the United States. She grew up as a young girl thinking that women now could live a full life, and she spent the first 50 years of her life, I think, in trying to enact that and experiencing many, many, many hurdles, and then trying to solve them. So she was amazing. She was also immensely analytical. She made sense of many hard situations in order to find ways to walk through them. And I would say that, I learned a lot from her every day. I also would say I'm a rare breed of a second generation feminist. There were a lot of levels of distress and anger, which I was able to perhaps telescope because she lived them.
What are some of the pros and cons of being a second generation feminist from the time you're a child? I've never thought about it that way, Ken. I would say that I was probably sensitive to looking at what was happening around me. I remember the first time I actively thought about this, this sounds trivial, but when you're 10 years old, it wasn't trivial. I remember I was in 6th grade and I really wanted to be a crossing guard. And I wanted to wear that wonderful orange sash that you got to wear. Mm-hmm. And I thought when I was in 6th grade, I'd get to do that. And then I was told that girls didn't get to do that. And I was overwhelmingly crushed. The world fell in, and in a lot of, in ways that happen to 10-year-olds. Mm-hmm. But what I also realized at that moment was that this seemed wrong. I'm not sure if I hadn't been my mother's daughter, it would have been so clear that it was wrong. Mm-hmm. But it was also wrong on a grand scale that we waste people in our world at a large scale, and that I think has affected me my whole life. That's wrong. Thank you. So you've been a trailblazer pretty well your whole life. First this, first that, starting this, starting that, leading this. When you face adversity, and we have a lot of people on this call from all over the world, and we'll be watching this for years to come, who maybe think you take a workshop and you just visualize things and it all falls into place. So when you face adversity, how do you keep going? I mean, what do you call upon inside yourself to become a warrior if needed?
Well, I'll answer it from a personal position. That's all I can say. But mm-hmm. but I do try and ask myself what I believe is right. If I suppose one of the benefits of being even though women are not in the minority in the world, of being in a minority group that's mm-hmm. historically disadvantaged. All women are in that group, but so are 3/4 of the world's population, actually. Mm-hmm. So I have, for whatever reasons, always asked myself, do I believe something's right? And as a minority group member, I have less vested interest probably in the status quo than people who have clearly benefited from it. And perhaps that's freed me up to ask that question. But if I have believed something's right and I think it's important, then I also I think I've had an ability to figure out what a key lever might be to solving it. And if I can see that, then I am not afraid to take it on. But I also would say that the tools of science, the tools of medicine, give you tools to do that, and I've been enabled by that.
Stay with me on this right and wrong. Doing what's right, knowing what's right. Is that based on law? Is that based on religious training? Is that based on your parents' guidance, or what, learning along the way yourself? How do you have clarity about right versus wrong?
That's a good question. I don't think it's based on what I've been told. I think it's pretty internal thinking, because probably a lot of the things I've done, I was told not to do, to tell you the truth, that it wasn't wise. But I think I have tried to use what I have to improve the world.
And is that a driver for you? A lot of people get up and they think, hey, the world's got its own problems, not my problem. I'm going to try to get a nice house or have fun with my kids or whatever. But you get up and you're trying to improve the world.
I am. That is what gets me up in the morning. But, I also feel very lucky, very privileged that I've been able to acquire tools with which to try and do that. I mean, any physician has become a physician to my mind because they want to improve people's lives and health.
Mm-hmm.
So that's not a rare impulse. Any public health professional who takes that on is doing it to improve the circumstances of everyone's lives and health and well-being. There are millions of people in the world who wake up every morning with that intent. I don't think that I'm a rare bird on that.
Good. So this is a little bit of a People magazine question coming here. So in 1982, here you are, a physician epidemiologist, and you married a physician epidemiologist. So what happens when you guys disagree? Are you right most of the time?
No.
I mean, it's almost a Sesame Street scene. I can see the two epidemiologists, sorting their way through what's so.
Oh, I don't even know how to answer that. I think we're pretty good at trying to think our way through things. And I think we're pretty aligned on values, which always trumps everything else.
Yeah. We're going to come back to the Trump word in a little while. Maybe. So I've got a question for you. There's a lot of uncertainty, in my view, after having been in this territory for 47 years now, about what I'm responsible for, my personal responsibility for my health, versus what the public is responsible for, versus what is a systematic or systemic barrier or on-ramp. And then there's also, access. You got access, I'm sure you do, to really great doctors and great healthcare access system. So how do you, and I think the word intersectionality was probably crafted after somebody read your bio, you look at the world through all these different lenses. How do you reconcile the personal and the public in terms of accountability and responsibility for health?
Well, I think first I look at the data, and if I look at the field of health and public health and medicine, we've gone through a number of evolutions over the last century, which are what have shaped a lot of that thinking, and which needs to be changed or is being changed. So there was certainly a long period in the latter half of the 20th century when there was a real shift toward personal responsibility for health as the unique thing that would determine whether one was healthy or not. There is a lot to health behaviors which are defining. There's also some amount of our genes, about 10%, which is of our health is defined by our genetic inheritance.
You keep going, but how much would you say accounts for the personal behaviors and choices? What percent would you give that?
Well, I'm going to change what you just said in order to answer the question.
Okay.
So I would say that about the data would say that 20% of our health comes from medical care, and the rest from the universe of public health. Some proportion of it is our health behaviors, and a huge proportion of it is the context that makes it possible for us to carry out good health behaviors or not. And the environment, both the built and physical environment, and whether it has toxins, air pollution, a million things that adversely or beneficially affect health. And that adds up to about 2/3 to 3/4 of our health comes from all of that. And what we've learned, I'll give you the example of loneliness, something that has been hugely focused on in the COVID pandemic. But I think the data are clear, has been increasing a lot in the last 30 years globally in many, many, many countries. It's not increasing because people have, been seeking connection less, I think. It's been increasing because the conditions of our lives have changed. And there are what we would call a lot of structural obstacles to connection and cohesion, which have accrued over the last 30 or 40 years and socially construct loneliness. And we saw that in this pandemic for so many people, certainly for older adults who have, as a product of older age, have lost people to death and illness, are in high degree in the US living alone. And then on top of that, there has been, in many places, a withering of a lot of the social infrastructure that brought us together, the social capital, the community organizations for collective benefit and good that built social networks and cohesion. A lot of that has frayed. And so the emergence of loneliness as a health issue, as an issue of human well-being, because social connection and cohesion is so important to us, that's been socially constructed to a very good degree. And it was exacerbated when older adults, but really people of all ages, were dependent in the pandemic on broadband access and connectivity to see each other. And suddenly that structural obstacle was the coup de grace.
So clarify for me, assume I'm completely uninformed. So clarify for me the difference between loneliness and isolation.
So social isolation is a count of the number of people who you see in a week or a month. And if you see very few, you would be defined or talk to, connect with in some way, very few, you would be characterized as socially isolated. Loneliness is a subjective experience, a painful, subjective, deeply human experience that the connections you do have are not satisfying, are not bringing the meaning and sense of connection to others that one needs. That's very different, and it's not necessarily related to the count of the number of people you see.
So there's a lot of young people today who seem to have a lot of count numbers in their IRL, in real world or on the online, who feel lonely. Does that trouble you?
It troubles me deeply, actually. And I think it should trouble everybody. It troubles me because some of that may be, as you're suggesting, a product of the internet and that there's some types of internet connections which seem to be driving a sense of loneliness for young people, particularly use of the internet without direct human connection. Internet used to amplify relationships you already have in person seems to be just great, but the other is great. Your 350 best friends, probably not possible to have deep relationships with all of them, and that really leads to a sense of loneliness.
So there's this loneliness and another dimension of it, FOMO, fear of missing out among young people. Would you think of this as a public health issue?
I absolutely think of this as a public health issue.
When you were studying public health, did social media and technology, was that on one of your course?
Not so much. I would say it wasn't in anybody's course until the last year, maybe the last 5 years, because the field's only about 10 to 15 years old.
So I have another question for you on this. So I've been thinking a lot about this last year and a half, and we'll come to your views about this last year and a half. But one of the things I've been thinking is that sometimes you take a good thing, but you let it run amok, and it could be not so great. I think capitalism is sort of run amok. It doesn't seem to be all that concerned for right and wrong and the good of everyone. It's a few people getting really rich. I think that individualism, neat idea, Abe Maslow, self-actualization. But if we don't think in terms of all of us as being a collective, I think that's problematic. And after World War II, with the rise of this sort of middle-class affluence, huge focus on independence. You should have your own room. You should have your own TV set. You should have your own car. You should have your own ID. You should have your own life. Do you think we've taken independence too far and that we should be more, especially in terms of housing and community, more angling towards interdependence and community?
So the answer is a resounding yes. The second half of the 20th century was all about independence, and there are many positive aspects of that, but we've designed our built environment for independence. If you look at many apartment buildings, you certainly in the US, you won't find a place where people can come together. We're doing it. We have actually disinvested in many of what I would call social infrastructure that brings us together. The community organizations, the libraries, the collective action within communities, or a sense that we're all in this one together. And John Cacioppo, a social neuroscientist who, as you know, created the field of loneliness along with Louise Hockley and others, made the point that there are multiple kinds of loneliness. When we think of loneliness, we think of the need for an intimate relationship with another person or meaningful connections with family and friends. John pointed out that there's a third major kind of loneliness, which he called public or collective loneliness, which is the deeply human drive, with an painful experience if you're not meeting it, to have a collective identity that protects all of us together, in which we can accomplish things more than any of us can accomplish solo. And that is a critical part of our human inheritance over the millennia, because of our basic understanding as people that we can't survive alone, and that we can't build a better life except together. And
sorry. So first of all, thank you for your clarity. I mean, it's so fun for me, and I'm sure people taking you in, to see the way your mind connects and holds so many different spaces. So in your mind, housing is a health issue. Communities are a public health consideration. Relationships is not just the domain of psychology, but it's the domain of urban planning and so on. What should we have learned from what's taken place in America and the world the last year and a half? What are 2 or the 3 of the learnings that should have come out from this thing we've just encountered, this situation we've been in? And by the way, what for you has been the worst part of the last year and a half, personally?
Well, there have been many. I would say probably the easiest one to talk about is the politicization of what should be not just bipartisan, but nonpartisan issue, which is what does science say about what it takes to protect people's health in a pandemic? That is, we know that. And there are probably hundreds of thousands, if not millions, of people who have died because we didn't use it and we politicized it. That to me is, I hope it's a learning. It's certainly an observation. The second thing to my mind, if you say, what have we learned? I would say that solving health is a collective action problem. We are all in this one together. And the people who came to the pandemic with the worst health were the most vulnerable. But we have, in a lot of ways, created those circumstances of worst health, and ultimately they affect all of us. They're structurally created. Air pollution, whether you're in Delhi or in the US, air pollution heightened risk of severe illness with COVID, as well as its transmission. That's a structural issue which an individual can't solve. So I think that's the second thing, and the third is that we're all vulnerable, and the sense of and that probably one of the dimensions of COVID, which we haven't even seen yet, is another form of long COVID, which is that there has been so much moral injury and mental health consequences.
Moral injury. I've not heard those two words put together. What do you mean?
So, I mean, families who couldn't, I'll make this personal, say families who couldn't be with someone they loved when they were ill and dying because of the contagion of COVID. There is moral injury in that, in the pain of not having been able to be there. There's also moral injury when governments do wrong by the people they're serving, and people feel harmed and with a loss of trust and belief in shared governance. That's a wide range of moral injury, from the very personal to the political. But I think we're going to be seeing a lot of consequences and hopefully lessons learned and healing. I think the other thing is the generations need each other. There are fabulous examples of people crossing the generational divide, because we really are divided generationally, and certainly in the US, which is now the most age-segregated society in the history of the world.
Really?
And yet we need each other, and generations each had a lot to contribute to each other.
So I'm gonna dive in there for a moment, and I've got pages of questions, so I'm gonna pick up the pace a little bit. So here you are realizing these things during COVID. I'm sure you've realized them for a long while, but COVID has brought certain things more to focus. Quarter of a century ago, you and our friend Mark Friedman started Experience Corps. You were in your 40s then. What were you thinking?
So when I was in the late 80s, I was seeing patient after patient after patient, older adults who came because they felt sick. They wanted to see a doctor. And time after time after time, what I found in taking a history from my patients was that the reason they were sick was they had no reason to get up in the morning. And that started me. These were immensely able and talented people who wanted to get up in the morning with meaning and purpose, and the opportunity to enact a very age relevant goal, which is to feel like you've given back. An age relevant goal to know that you've left a legacy that will endure beyond you. And people were sick because they couldn't find a way to do that. I had retired CEOs who the month before were leading corporations, and the month after were invisible and didn't have a reason to get up in the morning, and no place to put their years of accrued ability and wanted to. And I had housewives who had never had a chance to make a difference in the world, and in their late 70s needed to. And that started me on a long journey, actually long before I met Mark, of realizing the immense, unprecedented social capital we have in the world that we have never had before in human history, which we have created. We have created this by societal investment that's added more than 30 years to human life expectancy. We've created this. And that led me to a huge deep dive to try and understand what the assets and capabilities are that we accrue as we get older, which are huge. What the structural lag is, to use Matilda White Riley's term, between those capabilities and what people can deploy them in. I used to write prescriptions to my patients and say, go out and find something that matters to you and do it and come back and tell and report. And 9 out of 10 times they could find nobody who wanted them. And when they found a volunteer opportunity, I remember the CEO, one of the CEOs I mentioned, was put in a corner licking stamps on envelopes. Now, we don't know we waste people. We don't know how to make use of this unprecedented social capital. And that led me down a long journey to try and figure out if I could develop a model to show that it would be possible to build new societal institutions for this new age we're in which people can give back, not on small scale, but at scale, to address the huge needs we have societally, which they're uniquely capable of doing.
So when you introduce this idea of an experience car, was it your goal or dream that it would be active in every community in America?
Absolutely.
So it's now a part of AARP.
Mm-hmm.
Has that dream been fulfilled?
No. It's been, and I'm not faulting AARP. I'm faulting the difficulty in taking up social innovation at scale.
Is the difficulty that people aren't ready for it, or creating changes so hard, or the people who come up with the ideas aren't tough enough to bring it about, or whatever? What would have to be different for transformations to occur at better clip for the good of people?
Well, if I had my way,
yeah,
I would say we need a very big narrative suited to the magnitude of the problems that we have and the unused social capital that could solve it. I would say in every country, we should have the leader of that country have a call to action for older adults to sign up. You don't have to, but if you can, we need you. And we'll build the infrastructure, the societal institutions in which you can contribute your unique and immense capabilities so that we can add them up together and take on the following 5 most critical problems for our country.
Do you feel that you've benefited from having mentors in your own life in addition to your mom or dad?
Absolutely.
What should the role of a mentor be? Or why would people want to have one, or should you have 10? What's the ideal mentor arrangement?
Well, probably you need different arrangements at different times in your life and different in your career, and probably different people. But I often tell my students that a career if you read somebody's bio after 30 or 40 years of work and they've survived, it looks like a straight upward line. But in fact, a career is a series, is really like a sine curve, right? And you draw a slope through it. And you need mentors when you hit that bottom, which I've done many times, to help you see how to get back up, but also to be able to interpret the data so you don't bail out. Because it's an opportunity to learn something, and mentors are absolutely critical to tell you that you have to reassure you perhaps that you have the capability to keep going, and to help you see how you could do it better, and then you end up on the upslope.
So there's 2 points I'm going to ask you to follow up on this. First, do you have any mentors in your life that you can mention as having played a formidable role for you?
I have to start. Of course, I mean, there are many. There's certainly the woman who chaired the admissions committee that admitted me to medical school, and then was a mentor, and believed in me when I wasn't sure that I believed in myself. I had a mentor in my Aikido teacher. I would say Bill Hazard was, of course, a seminal mentor, because he walked into my office one day and told me I should be a geriatrician. And I had never thought of it, and probably wouldn't have if he hadn't done that. And then I changed my career 36 hours later and joined him. And he did. He changed my thinking, my work, and was always very generous about it. And I've had very generous and thoughtful mentors who've given me counsel over at critical times, and believed in me, and stood behind my left shoulder when I was taking risks.
And you also mentioned a few moments ago that when things have not worked out and you've been in a down place, it's hard to imagine you failing. How do you get yourself back up again? Because there's a lot of people in their 20s or 30s who are frightened of failing for fear that that'll knock them down and knock them out forever. What would you say about failure in your life, its role, and how you got yourself going again?
I'm trying to think how to think about that. I mean, I have a son who's very interested in the concept of failure, and he spent many years worrying about it, and we had many conversations about it. I think, failure means we're actually trying to push the boundaries on something, and that way didn't work. My husband quotes Thomas Edison. Somebody once asked him, "How was your year?" He said, "It was fabulous. I tried 759 different ways to make a light bulb, and none of them worked." And the person said, "How could that be great?" He said, "Because that's 759 fewer I have to test now." I mean, I can laugh. When you're feeling like a failure, it doesn't feel good. It feels awful. And you do question your self-worth, or at least I do, and I question whether I'm capable. And but in my experience, you can always learn, and then you need to use the people around you to help you see what you missed.
Thank you. Thanks for that, my friend. So another question. Not everybody wears as many hats as you. You don't have any on today as a visible hat, but here you are, the dean of a public health school. Here you are, the human being who 13 years ago introduced the idea that climate changes were going to impact global well-being. Here you are, a scientist. Here you are, a clinician seeing patients. Here you are, a mentor. Here you are, a writer. Academician, scientist, clinician, writer, game changer. How do you contend with not being all siloed into one particular thing. Does that make you screwy, or is it motivating?
But it's hard work. I work at it every day. But some of it, actually, I would say there are many ways to figure this out. I'm sure other people do it other ways. But my Aikido training has helped a lot. When I said I use it every day, I do. And it gave me some discipline of mind about how to focus totally on whatever you're doing and be able to change on a dime and keep your balance. Now, that's a physical training, but I find it very helpful. But I mean, there are many tricks I've used over the years to learn how to stay focused on the things that I feel are important, and to kind of use a discipline of staying on it. And there are habits of inquiry that I think science, maybe medicine, taught me of trying to figure out what I think is important.
Got it. Question. So when I was 24-ish, maybe 25, that was a long time ago now, 47 years ago, I was lucky to have found Bob Butler as a mentor, and Maggie Kuhn same year. So they were both kind of bustling me along. And one day I was having a kind of a somber discussion with Bob, and I said to him, I don't know that this field is for me. It's not very innovative. There's a lot of hand-wringing. And he said to me, well, you can either leave the field or you can consider changing it.
Mm-hmm.
And I remember thinking, wow. However, here you and I are. Ageism still persists. Our progress with regard to brain health is not great. We still got horrible diseases. More than 95% of the housing stock in America is not aging friendly. In fact, a lot of people's homes are dangerous. We've got ageism in the media. We've got disrespectful marketing. We've got gerontology as a subject losing students versus gaining. Have we failed? Those of us who have been the pioneers or the battlers, have we failed to fix these things, or are they so big that they're going to take next generation?
Well, I don't think that it's time to write a tombstone. I think actually we've learned an immense amount, which is the flip side of that coin, which could enable us right now at a very critical set of potential inflection points to completely flip the coin over. And I think we're at that moment. I'll give you a couple of examples.
Please.
So when I was in training, and actually I remember Bob Butler being in some of those rooms, one of the arguments of my betters in science and aging, once I had decided to become a geriatrician, was would prevention work in old people, and would it matter? So that was the mid to late 80s. Well, lo and behold, 30 years later, we think it's normal to understand that prevention works and matters into the oldest stages. We think it's normal to take for granted what science has only shown us in the last few decades, that half of chronic diseases are preventable, that health is malleable. It's malleable into the oldest stages, that societies that have invested in the conditions that create health, healthy environments, more public health, better access to medical care, higher education, countries where you see that, you see rates of cognition going up into the oldest stages and rates of dementia going down. So what we now know is dramatically different than what we knew at the formation of Medicare, than we knew in 1977 when Hubert Humphrey, gave his famous speech about what the role of government is. The moral test of government is how that government treats those who are in the dawn of life, the children, and those who are in the twilight of life, the elderly. We know that's still true, but we know so much more now. We know about the cognitive and socio-emotional capabilities of older people. We didn't know that then. We know that you can actually invest in them and deploy them for good for the older adult and good for society. So we could turn this on its head. We could create a big vision of the opportunity. And we also know, and you know this as well as I do, that everything you design for older people is good for every other age group. We know that, whether it's designing a city or whether it's creating Medicare or Social Security. Those are family policies which were designed for the families of older adults as much as for the older adults themselves.
So let me ask you, we got 11 minutes to go and I've got a lightning round of some questions. Words. Do you like elder, senior, older adult, elderly? Which of those do you like and which of those do you think you are? Are you a senior? Do you think of yourself as a senior?
You know, many years ago, we did a study to ask older people, when I was in my 40s, to ask people who were over 65 what they wanted to be called. And resoundingly, what the data showed was people like older adult, and then number one, and seniors number two. Now, we have a new generation of older adults, and I haven't redone the study. But I probably would go with older adult for myself.
Do you tell me what the essence is of the thinking you've been doing that you're referring to as the third demographic dividend? It's a fabulous framing. What's if you could boil it down, what is the essence of that?
Sure. So we have unprecedented capabilities and assets. Society has gone through two predicted and predictable transitions that have led to the longer lives and aging of society. A first demographic dividend when we were able to stop kids from dying in infancy and childhood and women from dying in childbirth. Then the second demographic dividend when those kids survived to young adulthood and could make up a productive workforce. And since then, we've been extending the age of the productive workforce. We have not described that leads to wealthier societies that can invest more in human capital and other things. We haven't described anything that goes after that. And if we invest in creating a health span for everybody that's as long as our longer lives, so we're living longer lives with health. If we build the societal institutions that enable people to give back at scale, which they need and want to do when they're older. If we unite generations, I believe that evidence is that we could create something we never predicted before, which is a third demographic dividend. Built on the assets of having longer lives and bringing generations together and powering the success of young people.
Fabulous. So when you hear the meme, okay, boomers, what goes on inside of you, my friend?
It's what I see all over the world. Young people are pissed off and justifiably so about being
pissed off. Is that a clinical term, a scientific term, or an academic term?
It's a very clinical term, yeah. They're angry about that they're inheriting a world which is a really serious mess, and in fact, in the face of climate change, an existential threat. And they're scared, and they're mad because they feel that they've been abandoned by people who are more senior. Do you agree with their perspective that the older adults are not doing all they could do, being all they could be? I think none of us is doing all we could do. I think we have a different kind of structural problem, which is that the older adults, I think, are the most future concerned age group. In the pay it forward stage of life, but they don't have the knowledge of how to affect change or how to join forces, and they don't hold the power.
Got it.
And I think we need to resolve that expression of distress, pain, anger by enabling generations to join forces on these issues. Jane Fonda did it in Washington for almost a year. The elders do it every day. There are many examples. I've tried to.
And by the elders, you mean that which was created by Desmond Tutu and Jimmy Carter and Nelson Mandela years ago. That's what you mean by the elders. There's a group, right?
Yeah.
But there could be more of that. All right, next question. I want you to put on your thinking cap here because I want a very focused answer. What's the main advice you would give to the next generation who want to be change makers?
Go for it.
Say this. I'm sorry, I didn't hear you.
Go for it.
Because if you don't, what?
I think our world is one of constant change, and our job is to recognize where the change is going and get it to a better place. And unless we're leading the change, we're going to go backwards.
Okay, next question. I'm going to get personal for my last few questions here, a little more personal. When you think of your own aging, so here you and I and many of the people, we're going to be Fernando and Purcell and Terry Fulmer and all kinds of folks. We've been in the field for 40 plus years, and now we're in our 70s or older. Paul Nathanson a few weeks ago. Do you think of your own aging as being an ascent or as a descent?
I think it's complicated. What do I say? I can understand things now that I couldn't have understood when I was in my 40s. And some of that's a product of having worked at it a long time. Mm-hmm. And that's actually a wonderful experience I wouldn't give up for the world. I think that I'm able to have a lot of fun now in ways I couldn't do earlier, maybe because I was too stressed about how to balance a family and a career and lots of other things. On the other hand, I don't get that all this time has gone by. I can't process it. I don't understand it. I'm now the age that I used to recruit subjects into study.
Right. Right.
And it's very hard to understand. I think the biggest puzzle is that we don't have the menu of roles that I hope that people will have in coming years. So we don't have models of what this should mean. And I think it's very hard to process what this means without an array of models to kind of key into and help think about.
Okay, I've only got 3 or 4 quick questions before we wind it up. So there's people in their 20s and 30s now that are thinking, maybe I'll be a real estate agent, or maybe I'll be design automobiles, or maybe I'll go in space with Elon Musk and whatever. Why would you want to encourage people to get interested in the aging field or the issues? Why?
Because it's possibly the most interesting thing.
Totally.
That you could spend your life thinking about, which if you want to grasp at the solutions that are needed, demands the biggest act of imagination possible in the world. And that is very exciting.
Okay, if you play with me on this for a second, we're going to go a little science fiction for a moment. If you could travel back and sit with your younger self, let's say in your 20s, and give her one piece of advice for how to make the best of this life, what advice would you give young Linda Fried?
Well, the implication is advice about doing things differently.
About anything.
Yeah, I probably would have kept doing Aikido all the time instead of letting it go physically for medicine. I think making sure to invest in yourself, in your growth, in your friends, as well as family. Trying to find the right balance. I mean, I've always tried, but I wasn't always successful. Those are the, that's what comes to my mind.
Excellent. So 2 more questions and we'll be done. So this next one is a little bit peculiar, and I apologize if it's too peculiar, but if your mom could see what you've made of your life and yourself and your leadership, what would she say?
I don't know.
Would she feel that you carried the baton forward? Would she feel that you took this mantle of second generation feminist analyst, as you said your mom was, trailblazer? Would she feel you had gone for it?
My husband says she'd be pleased.
Good. And here's my last question. So imagine it's decades in the future. I'm no longer here. You're no longer here. None of the people in these legacy interviews are alive anymore. We're gone. What would you like for people to say about Linda Fried? Linda Fried, she...
I hope that I have been able to use the tools of knowledge and science to contribute to making a better world, and that I've demonstrated a woman as a principled, effective leader. I also hope that the knowledge we've created will matter, and that it serves as a transformative levers for better care of patients, better investment in healthy populations, and investment in a successfully long-age society.
So let me say, as we wind up here, that I would say, in addition to knowledge and insight and leadership, your heartbeat is so moving. Your warrior spirit, the fact that you have for year after year, decade after decade, if there were a Mount Rushmore in this field, your face would be right there beaming out. And so I just want to personally thank you for your friendship, for your leadership, and for your focus on right and wrong and trying to advance the field, the world, and people, especially those who are struggling and with the aging experience. So thank you, Dr. Fried.
Back at you, Ken, and change is a team sport. So thank you to everybody.
Everybody stay safe, stay well, and we'll see you next week.